I am Dr. Shibu Vijayan, Medical Director Global Health at Qure.ai. I am today with Dr. Varsha Puri, who is a CTTB officer of Mumbai Municipal Corporation.
So, thank you, Dr. Shibu, for calling me here and asking me a very important topic and discussing a very important topic like TB and elimination of TB and strategies of that. I am working with TB since I think 2012. I have been associated with TB and I have seen the highs and downs and ups and lows of the TB and TB cascade care. So, I am also working as a DHO for a very important zone 5 where TB cases are a very predominant area in MEs like Govandi and Chembur, where the TB is at a very high level, and we are trying to see how we can work it out the infrastructure reasons from there have been correlated with how we can work out for TB care in that area.
Mumbai caters to a population of 13 million and notifies 60,000 TB cases per annum. Mumbai is one of the highest TB burden place in the country. Mumbai has a plan for TB control, which is actually laid down as Mumbai Mission for TB Control, which has been active since 2013. And now I am aware, Dr. Puri, that we are in the third version of Mumbai Mission for TB Control. Could you please explain for us that how this Mumbai Mission for TB Control progressed so far, and what are the advancements made in the TB control in the city of Mumbai?
Yeah, so as you are well aware that Mumbai has a population of 1.23 million and they are situated in a very close-knit square meter area. So there are multiple factors which are leading Mumbai into giving lots of TB cases to India and also in the global TB forum. So what is happening is that because of this, there are personal factors like the patient behavior, the patient health-seeking attitude, infrastructures in Mumbai, with the railways fully packed, the close-knit slums in Mumbai, large slums in Mumbai, and then also administrative controls over lots of hospitals and dispensaries. All these factors are leading to a very large burden of TB in Mumbai. And yes, when we are planning for this TB control in Mumbai, what we are seeing is that it has to be controlled at all levels. Patient-seeking behavior, where we give adherence techniques and adherence modalities have been fabricated for keeping the patient adherence. Secondly, the infrastructure, we are doing the AIC control from other places like air infection control, how maximum we can achieve it. We are doing the administrative approvals for various new strategies which are being brought up in Mumbai. So this TB elimination of 1925, which is the third version of the TB strategy elimination program, here we have got these 5 pillars, which are search, detect, identify, then diagnose, treat and build. So all these 5 pillars have been inculcated in the book for this mission of Mumbai elimination, and I think in largely all these strategies or newer modalities like testing the close contacts through IGRA or giving TPT to the patients, you're doing larger number of x-rays, bringing Qure.ai or AI related techniques into our program, so that all the notifications are being brought earlier to us, the treatment is taking faster, the prevention is occurring, and we are moving towards the elimination of TB control for India.
Yeah, wonderful, Dr. Varsha, for laying down that plan. And I kind of summarized like this. You stated that there is a burden of disease here. There are social and urban-related factors, urban migration-related factors, which is augmenting the disease burden over here. You have laid down steps for engaging private sector. You have laid down steps for ensuring adherence to digital technologies. And Mumbai has been always a testbed for embracing new technologies. And now you are talking about infection prevention at the community level and also bringing in IGRA tests for treatment of infections. And also you mentioned about the plan is laid upon the Government of India's National Strategic Plan strategies of detect, treat, prevent and build.
Yeah.
And then building onto that case detection focus, we are aware that you are also focusing on a couple of high impact case finding initiatives using technology. Could you please elaborate on that?
Yes, so what we were talking of right now is about what the search factor. The more we bring in notifications of TB patients, the earlier treatment will be starting them, and that is how we will go towards elimination by prevention. So for this, initially we used to do X-ray test for all the people who were suspects with symptomatics of this thing, and these X-rays were being done at our dispensaries at hospital levels, or we have engaged private partners to get X-rays done for the private sector also through voucher system. Now in this, the newer initiative which we have brought about is the Qure.ai based X-ray technology, wherein in 60 seconds, in 1 minute time, you are getting abnormal X-ray detected by the normal X-ray also when they are being taken. So in this abnormal X-ray, when we are getting an abnormal shadow, we are then putting the patient in the cascade of our TB care treatment. He is going into for the sputum collection. The sputum is going on NAT, and then spot sample is being collected immediately. So the time period for first getting an abnormal X-ray as well, and then putting the patient on sputum, where is immediately available at that point of time, has really led us into a long way of getting immediate patient notification. And this has given us an incidence, and this technology is also very specific. The yield which we are getting it in, we have started this technology in our 8 peripheral hospitals, where we are taken almost around 75,000 X-rays in this year, and out of this we are seeing incidental 20% positivity rate is being seen. With this, we have hired one van, which is a mobile van, which goes around in the high risk burden areas, and they are taking Qure.ai based X-rays there. Even there, 14% with 9,000 X-rays, we are getting almost 14% incidental positivity. So I think this which has been based with AI techniques is very immediate effect, and the sputum is collected there. The patient doesn't have to go on a second round. The out of expense pocket for the patient traveling is cut down upon. The doctors involved are less, and immediate reporting is leading us to put the patient into the cascade earlier and prevention earlier. With this also, we are doing adherence scheme, like our Nikshay Mitra is coming up, where by adopting a patient for nutrition aspect of the patient. We are doing TPT and EGRA for patients, where in the contacts of pulmonary positive patients are caught immediately, and they are also started on therapeutic treatment with for 12 weeks period time. So I think all these modalities are definitely taking us further, and Qure.ai is along with our partners have really taken this program to a second level, and I think we'll be achieving our elimination in this way with new technology a bit faster.
Brilliant. So essentially what I heard is that you have a battery of digital solutions and also prevention solutions plugged together, so that the cascade of TB care is being completely covered, and it's also digitally augmented. I also heard from you that there is a lot of efficiency factor came into this picture by using AI. The turnaround time for diagnosing the patient, there is a sports sample which is being taken. So a lot of efficiency came into picture. And given that you were able to detect more number of cases, and I mean, wonderful that you mentioned about incidental cases coming out of it, which would have been missed otherwise. And you're saying 20% of that, I mean, of whatever diagnosis coming through this initiative. That's also like good to hear that how do you use technology. And I think this is again achievement from the Mumbai mission for TB control and Mumbai corporation to design and deploy such innovations in the corporation for case finding. And this is a high time to now expand and scale up into other facilities. Do you have any plan for further scaling up these kind of initiatives into other level of facilities? Now I understand that most of this deployments are in the secondary level hospital. Do you also think that there is a value addition will be there while you deploy it in the smaller clinics or even bigger hospitals?
Yes, definitely. What you are saying is the whole point of control of disease in Mumbai is based on decreasing the tertiary load of the patients to the tertiary centers and giving patient the treatment, the diagnosis at their home. So cutting down the catastrophic pocket expenses, traveling in public transportation. So definitely we are now, since we have started it in these 8 hospitals and with the van going all around, we are now thinking of bringing this down to the primary level of our dispensaries. Mumbai is catering to number of dispensaries, around 200 dispensaries in and around, for a population of around 50 to 60,000. 50,000. So in these dispensaries, we are catering to 5%. We are thinking that the 5% of the OPD would be cough OPD. So in these, we are giving the X-ray vouchers, which are being given and distributed elsewhere to the private X-ray technicians and X-ray facilities available. So we can definitely put this Qure.ai based system there, and the dispensary itself at the primary level, we can catch patients and bring them out in our TB cascade. Similarly, in higher tertiary centers also, the time from taking the X-ray to developing the film and then giving it for reading to the radiologist, also there we can definitely try and put this system into their hospitals and cut down on the patient traveling from one place to other place, and also getting a faster and a quicker diagnosis. And again, in a bigger hospital, there are multiple people going with multiple reasons, may not be the chest reasons. And since Qure.ai has given us out of the non-symptomatic also, the rates are very high in detecting this. This will definitely work in the tertiary care center where patients are going with other symptoms and they may come out to be TB, and definitely we are missing these patients and they are roaming around in our crowd. So yes, Qure.ai is the technology which is required at all three centers, whether primary, secondary or tertiary. So we are looking forward to putting this technology into our medical colleges, into our secondary centers, and of course the primary centers. And to all, we are having 18 peripheral hospitals in Mumbai. So now at present we have started with 8 sites. We are looking out for reaching out the other hospitals which have left out also, and try to put Qure.ai based technology in these centers too.
So thanks for actually letting us know that you have a plan for, so do you have a two-pronged plan? So one is to decentralize this technology to your clinic level, so dispensary level, which caters to a population of 50,000 to 60,000, wherein this enables LA detection. You also would want to, given that you are now seeing value addition of incidental cases coming out to an extent of 20%, you would want to explore other hospitals which are bigger teaching hospitals. Correct?
Absolutely correct. Absolutely, what you are saying is that we want to in fact expand this, because as I told you that our private notification and our public sector notification is now 50-50%. We are getting equally patients from private sector notification, and we have lots of schemes for private sector engagement with public sector, where we are giving medicines, the other medicines for drug sensitive like delamide and bedaquiline have been also provided to the private sector. So in view of this, I think Qure.ai can also reach out to the private sector X-ray technicians, where they can put this X-ray, or a bigger nursing homes could either have this X-ray facility which can give them quick results, and they can demarcate these patients and put them in, under the program earlier. So definitely yes, we need to expand this program not only in the public sector but also in the private sector based Qure.ai or artificial intelligence based thing is the in thing for Mumbai now, if we are moving towards the elimination program.
Brilliant. So reimagining TB care was a concept so far, and then we have been talking about it since 2017-18 onwards. Now I am just witnessing that reimagining TB care happening in Mumbai, wherein you are augmenting all your patient cascade with digital technologies, be it case finding initiatives. You mentioned about Nikshay Mitra.
Yeah.
You mentioned about using Qure.ai as a technology to screen and detect and adding efficiency. You mentioned about digital adherence technology. You mentioned about IGRA using for prevention. So, and you also mentioned about, airborne infection control, you are using digital application for that. So this is an excellent example of how we are leveraging technologies for TB control. And I would say this, we need to actually state the newer version of Mumbai Mission for TB control is digitally augmented reimagining TB care initiative, which
yes,
is we are now witnessing in.
Yeah. Yes, definitely we need all this digitalization, which is a need of the hour, because as you know that our Honorable Prime Minister has declared the TB elimination by 2025. 5 years ahead of the sustainable goal. So absolutely we do need to take all these digital help, whatever required, be it AIC control also, they are using the digital app to see the measures of air infection control, because you know, as our Honorable Prime Minister has already declared the elimination of TB by 2025, which is 5 years ahead of the global declaration by 2030. So I think we really need to faster gear up for the elimination, and faster gearing up means using this digital strategies, so that we get earlier reporting, earlier diagnosis, and earlier treatment of the patient, and of course prevention, as we say, is better than cure. We are using all these techniques to prevent TB from spreading, and that is how we are going to eliminate it ultimately by 2025.
Well, you're right. So we have our Prime Minister leading our mission for TB control, not only in India and globally, setting examples in our country. And I'm very glad to with you because you are also setting examples for TB control, and new innovations are bringing in here for Mumbai as well. So I would like to actually mention here, let's conquer TB together.
Yes, let's conquer TB together. TB हारेगा, देश जीतेगा.